Hello, sir.
Hi, good evening.
Good evening. How are you?
I'm good. How are you doing?
I'm also good. How was your
Sorry
day?
about sorry about the time preponement.
No, no, it's okay.
Yeah.
Uh, so as we are short of time, can you please introduce yourself?
So hello everybody. I'm Dr. Charan. I'm a psychiatrist. I'm working with Kim's Hospitals in Hyderabad. Yeah, I think that's about it.
Okay, so today we are going to talk about OCD and the myths about it and the misunderstandings. So, my first question is, what exactly is obsessive compulsive disorder?
So OCD, which is called as obsessive compulsive disorder, like you said, it is an anxiety disorder. Here there are two parts of it. One is obsessions, another is called compulsions. Obsessions are thoughts or images, whereas compulsions are acts or rituals. So I'll
Okay,
explain more about it a little later. So, on a brief understanding, OCD is an anxiety disorder.
okay, okay. Okay, so like you said that it's a disorder, but usually people associate this with neatness and cleanliness, and most of the people say कि हम we are OCD or everyone in life at some point of time is OCD. So how far is this true, and how is it very disturbing for people who are really fighting from OCD?
So, first of all, not everybody will have OCD at some point of their life. People can be clean at some point of their life or throughout their life for sure, but cleanliness is not OCD. If somebody is excessively clean, first of all, there's nothing called excessive. Excessive is a subjective word.
Okay,
I think I'm clean, but my friends always think that I'm excessively clean. Right. In
okay,
my college also a lot of my friends used to like make fun of me saying that, I have OCD, you know.
right,
Um, so being clean is not OCD at all because I enjoy being clean. I'm scared of germs because I get infected very easy. My immunity is not great. Um, at least not used to be great. That's why I used to be a lot more cleaner before.
okay,
Um, but in OCD, there is no choice. You don't enjoy being clean. You get a thought that, your hands are contaminated, go wash it. It's almost like somebody is controlling you with a remote control, in spite of you liking it or not. So you have to go and wash your hands. And for some time, you'll feel relief from the anxiety. And within some time, again, you get a thought that, your hands are still not clean, go wash your hands. So again, I go and wash it. So I don't enjoy it. It's distressful.
right.
It's anxiety provoking. Whereas being clean is out of choice. Yeah. So you asked me the second part of the question, what using words like I'm so OCD or my OCD is kicking in,
Yes,
you're triggering my OCD, etc. I think these are very insensitive words.
right.
I don't blame people. Usually, initially, I used to get very angry. I used to be like, "What is wrong with people? Why are they being ridiculous?" But then I understand that people don't know any better. If you don't know something, obviously, you can't do any better. That's why I think this
Right.
kind of awareness programs that people like you and me are doing are very important in terms of understanding that OCD is not some character trait or personality trait or a fashionable term that we all use that oh, she has OCD. Even when I
Right.
go out to a club or to have a dinner, a lot of people be making fun of each other that oh, you have OCD, and people who are being mocked at also are enjoying that they people telling that they have OCD. Mental health is not something glamorous. It's a very basic
Right.
thing that we all need to have. Yeah. So being insensitive by saying words like "my OCD is kicking in," "I'm so OCD" will be very distressful for people who are actually going through it. Let's just say,
Right.
let's just say you're using something as strong as rape on a very casual note. You know,
Yes.
It's not. I mean, I'm not comparing both, but I'm just saying some words, or using word called gay very loosely. Like okay, I think gay is perfect, right? The word, by saying somebody that, oh, you're so gay, or
Yes.
you're behaving like a gay person, right? And
Right.
you can't use uh, words very loosely. That actually puts a lot of distress to people who are that. I'm not saying gay is a disease, but OCD is a disease. Like, I'm just trying to
Right.
say the usage of words, wrong usage of words.
Yes, understand. Huh.
Yeah.
Okay. Thank you so much for clearly differentiating these two things. And the third question usually comes in our mind is OCD treatable or it's a chronic disorder?
It is treatable, very, very, very easily treatable. Sometimes it can get chronic, just like any disease. Um, the main factor that decides how chronic your disease will go is how early you start the treatment.
Okay.
Just like any disease, any disease in the face of medicine, in the field of medicine, early diagnosis, early treatment will reduce the chronicity of an illness, and also will reduce the after effects or aftermath of a illness. So it's as simple
Okay.
as, if people think that, um, just by doing some yoga or meditation, my OCD is going to go away, and they don't come and see a doctor, and they suffer, and it worsens over a period of
Right.
time. They come to us, they miraculously expect us to treat it within 1 month. That's not possible.
Right.
If
True.
I always ask my patients, how long did you have symptoms? They say 6 years. And how long you seen me? They say 2 weeks. Then how do you expect me to treat it in 2 weeks?
Right.
It's not fair.
True.
You know, yeah. So it's not. It can get chronic. Can get chronic, but I don't think so. You'll require like lifelong medications or anything like that.
Okay.
Also, it depends on, is it mild OCD, moderate OCD, or severe OCD. There are again grades, or what kind of obsession. There are different types of obsessions. It
Right.
depends on that also. Some are far more anxiety provoking and far more distressing than some.
Okay. Okay, so sir, as you said, it can be chronic. So if it does become chronic, will the obsessions remain same or it can change the pattern?
They can change the pattern. I mean, see, for most of it, it remains the same. There are different kind of
Okay.
obsessions, right? For example, contamination. It can remain
Huh.
same. But over a period of time, they can change also. You can have multiple obsessions also, and multiple
Okay.
compulsions also. Sometimes you may not have compulsions, only obsessions. Sometimes you can have only
Okay.
compulsions. It can change over a period of time.
Okay. And what are the first signs that, like, if I am having something, how would I know that I have to seek help or see a psychiatrist?
Okay, the most simple thing is, it's not normal thought. It's not a normal thought. You can always understand that, okay, this is not a normal thought. Why am I always feeling like my hands are contaminated when I know they're very clean? For example, I
Right.
just came from the hospital and I just took bath, and I'm sitting in front of you. There is no way that I'm contaminated, because I just washed off my hair, my body. I threw put my clothes away, and I'm sitting on my couch,
Right.
which is absolutely clean in my house. I know it's a safe space, but I'm
Right.
getting a thought that, hey Charan, your hands are clean. Go wash it. I try to resist it. Obviously, I don't go in the first go to wash it. I try to resist it. Immediately, I have a lot of anxiety. My heartbeat goes up,
Okay.
and I feel my mouth is dry. I feel like my chest is becoming tight. I feel breathless, etc. It gets very bad. Only when I go and wash my hands or whatever, my hair, then I feel like, okay, I'm better. Immediately, in some time again, I get a thought. So these thoughts keep coming over. It's not necessarily contamination. So there are different kinds of obsessions. This is where people need to understand, it's not only cleanliness, there are different types. First one is security.
Okay.
Sometimes you feel like repeatedly checking your doorknobs if they're locked or not, repeatedly checking if your fridge is closed or not, repeatedly checking if your gas stove is off or not, repeatedly
Right.
checking if any other gadgets are turned off or not. Right? See, for
Okay.
example, let's just say you might be having a grandparent who is always checking the door. That is not
Yes.
OCD. That is not OCD,
Okay.
right? That's just some
Okay.
people are extremely cautious, or uh, maybe there was a theft in the area, so your grandmother is
Okay.
very careful, or maybe she's living
Right.
alone. She's an old lady, so she's scared, so she's checking. That's not OCD, right?
Okay.
But if she
Right.
thinks that I'm abnormally checking, it's unusual for me. I'm not able to control the thought that I'm not in a safe space. That's why I'm checking. That could be OCD. So that's the first is contamination, then security. Third is symmetry. Symmetry is
Okay.
arranging things in order, right?
Okay.
Not because you like it some people like everything in a nicely put way. Not that. Here again, you're not enjoying it. You're distressed. You are having to do it because otherwise you're having anxiety. So you keep arranging,
Right.
rearranging. Again, you arrange, let's just say, your clothes in terms of color, your clothes in terms of texture. Not because you love arranging. Again, I'm telling. So that's one thing. Well, it gets worse than this when you're getting repeated thoughts that maybe your husband is cheating on you, or maybe your
Okay.
boyfriend or girlfriend is cheating on you, when you know that that's not true at all, but you're
Right.
keeping on getting this thought that so you're going and checking their phone repeatedly, and you're being helpless because you're being controlled by your brain. That could be your theory.
Okay.
The most severe thing you would see is sexual obsessions. Some will come and tell that I'm getting repeated images of let's just say Jesus Christ. I'm imagining uh,
Okay.
sexual images of Jesus Christ in my head. In fact, I'm not really fantasizing about God. It's called
Right.
blasphemy. They're getting these thoughts, and they're not able to help it. Such obsessions are very distressful than cleaning hands. That can get chronic.
True.
It might require, like, medication. I mean, even the mildest one might require medication, but this might require longer time of medications, because there it's not just anxiety. You'll also have death wishes, depression, suicidal thoughts, maybe drug addictions, other comorbid conditions. Yeah.
Okay. Okay, sir. Sir, and usually people associate bad parenting with OCD. So how far this notion is true?
No, I mean, so I mean, see, we usually put everything on our parents. That's not fair,
Right.
because they are also normal humans, right? They might not
Right.
want to do everything perfectly. It's okay. I mean, I think we
True.
should forgive our parents for the mistakes that they've done to us, right? Without their knowledge. But
True.
yeah, but definitely physical abuse or sexual abuse in the childhood can cause OCD. It's an environmental factor. See, mostly OCD is genetic. It tends to run in the
Okay.
family, right?
Okay.
Or if there's any gene mutation in your brain, or
Okay.
else, yeah, child physical abuse or child sexual abuse can be a risk factor. I'm not saying everybody who goes through abuse will develop OCD, but it can be a risk factor.
Okay. Okay, so, and the last question I have is uh, usually people associate mental disorders with being dangerous, scary, and they associate madness with mental disorders. So, how far this notion can be changed, and how far this can affect people who are really having a mental disorder?
I think the main mistake is coming from the portrayal in the media or in the entertainment, how they portray
Right.
somebody with mental health
True.
condition as they either portray them as silly or funny or extremely
True.
dangerous. There is a they put these patients on the end of the spectrum of behavior, right? Either you're
Right.
acting all retarded without having a brain, without able to think for your own good, or somebody who is extremely violent, dangerous, or who is a rapist or a murderer. They all say that
Right.
they have some psychiatric problem. It's often that it's sometimes it's humiliating that when some of my colleagues used to read newspaper that somebody got gang raped or somebody got murdered, they immediately used to tell me that I think you guys should treat people like that. They are just bad
Okay.
people. I don't think so. I can treat a rapist, right?
Right.
That person is a horrible person. That might require a capital punishment. They don't require a bed and a nice treatment in a luxury psychiatric hospital. I don't think so.
Right.
So I think that is just definitely wrong portrayal. Very few conditions, extremely like, let's just say 0.5% of all the psychiatric conditions, they can be behavioral derangement, which can cause unprovoked aggressiveness. But they're not dangerous, they can be very snappy, they can maybe throw things at you, etc. In very, very 0.5% is if 100 psychiatric patients are there, or 200 psychiatric patients are there, and that one person could be that. But that could be in fact, people who have hypertension are more dangerous because they get angry very easily, right?
Right.
They tend to snap at you, they tend to throw things at you, etc. So, but nobody talks about it. People with
Yeah.
diabetes, when the sugar levels drop, they get very, very cranky, right?
Yeah.
So I mean, there are many other conditions where there are far more, patients are irritable and could be violent, but nobody talks about it because
Yes.
it's not mental health condition.
Yes. It's a physical health condition, and ju- people certainly don't take physical health equal to mental health.
So
People are
again,
running behind the physical health only.
yeah. So no, but again, my thought process is that there is no physical health and mental health. It's not separate. It's health.
Okay.
There is health
Yeah, right.
in a picture. So what's
Totally.
happening is, I think, through this bifurcation of physical health and mental health, it's turning into like Indo-Pakistan war. These are not two different things.
Right.
Your brain controls your heart, and your heart controls your brain back, right?
True.
So all the organs in your body, they work together to create a perfectly healthy or perfectly unhealthy environment for your own good or bad in your body. So I think generally why mental health is ignored is because there is no awareness. There was no
Right.
much research. I always tell my students, if any of my students are logged in now, why we don't know so much about psychiatry as much as we know about, let's just say, a liver disease, is because we can't do research on a human brain unless the person dies. All the research that we
Yeah.
get is from the postmortem studies, and postmortem brain is not
Okay.
the same as the brain which is alive. For example, if you are alive right now, I can take a piece of your
Right.
liver from your body. I can do a liver
Yeah.
biopsy. I can take a piece of it and I can study it, so I know where the disease is coming from. But brain, you can't take biopsy. I can't insert a needle here and take out things.
Right. Right.
It's not
Right.
possible. It's not possible. That's why we don't have too much studies about psychiatry. But that doesn't mean that these are not real illnesses or these are not real conditions. Science is definitely advancing. I think we'll have a lot more clarity. That's when we'll stop associating the bad parenting and yayo,
Right.
to this, and we'll actually have a lot more clear and quicker treatments for improvement. Also, I'm hoping for that day.
True. This is something new I heard of, that we cannot like it is only after the death we can uh check the brain, what you said. We have a question from a user that do a person think in the same pattern in anxiety disorder and if he has OCD?
So there is nothing called anxiety disorder. Anxiety disorders is a group of conditions. For example, if I'm saying fever, under fever there is malaria, there is COVID, there is typhoid, there are many filaria, etc. So under anxiety disorders, there is panic disorder, there is social phobia, a social anxiety disorder, there is obsessive compulsive disorder that we're talking about today. There is generalized anxiety disorder. There are different kinds of conditions. So OCD is one of them. So there is nothing called thinking. Again, see, this it's you're not sitting and thinking that, "Arey, my hands are dirty." You're not
Right.
sitting and thinking because you're bored and you don't have nothing else to do in life. No, you are
True.
busy. Let's just say I'm busy. I'm talking to my patients and I have OCD, right? I immediately I get this thought that your hands are dirty, your hands are dirty, go wash it. So I might get up multiple times while talking to patient and wash my hands, and I'm very distressed about it, right? So not doing an act will cause anxiety. Only when I do the act of washing my hands, my anxiety calms down. But that's abnormal.
Okay.
How many times can you wash hands? I have patients who come and show me that their hands, the skin is completely rugus, it has a lot of, what do I say? It's wrinkled, it's shriveled, it's become dry because of putting so much of sanitizer or soap because of OCD. It's very,
Okay.
very sad. So what we try to treat is we try to treat the underlying anxiety. So then the thought becomes very obsolete. If my anxiety is not there, even if I'm getting a thought that my hands are not clean, I'm like, okay, so what, right? I let
Right.
it be because I'm not facing the wrath of it or fury of it. So that's
True,
what we're
true.
trying to treat with medicines. And there are some psychological techniques that we treat because somebody asked earlier, what kind of treatment is there?
Yes.
Medicines are definitely one of the first stay. I'm not just saying because I'm a doctor. Along with that, there are different therapies where they do habit reversal, exposure, response prevention, CBT. There are many therapies that they do. But if you ask me, sir, can I only do therapy and not take treatment? Because that's a common thing patients ask me. No, you have to take medicines because there are different circuits in your brain. For example, I have air condition running here because it runs on a circuit. Same way, my
Right.
brain also runs on multiple circuits. So some of the circuits are abnormal because of whatever reason, genes or environment or whatever. That has to be corrected. Counseling can't
Right.
correct it. Counseling can correct the manifestation of it. How
Right.
do I not get bothered by this thought? But how do you
True.
stop the thought? That only medicines do, right? So
Yes.
unfortunately, you'll have to take medicines, but it's not so unfortunate because there are many, many safe medications out there.
Okay. Okay, sir, if time allows, can I take one more question?
Sure.
Uh, so, how did you manage your mental health with so much pressure in medical school, and then now you see so many patients, and how do you manage your mental health, and how does do other doctors also do so?
So guilty as pleaded. I think doctors are very bad when it comes to stress management. We somewhere our profession we glorify hard work. We are so proud that we're so hardworking. We don't sleep well. We are working in the nights also. I think it has to change. I don't know how it will change. In America, if you see a doctor will only see like 5 patients, 10 patients per day, right?
Okay,
That's all they have to see, and they only work 5 days a week. Sometimes they can
okay,
even work. They'll have to work 48 hours a week, right? So they can
okay,
finish that 48 hours in 3 days also and take rest for the next rest of the 4 days, right?
right,
But we are working all the 6 days, and on Sundays also we have duties. If there is no duty, we have to go and do rounds and come back. People who are admitted will have to obviously see them that day. So
right,
I think the I don't know how to change that, but how do I reduce my stress levels is that everyday little things is what I do. 4 to 5 is when I take my break, right?
okay,
Because 4 I finish my OPD, I come home. I come home in 15 minutes and 45 minutes I take rest. 5 o'clock I have online calls, which runs till 7 or 8. And at 8 o'clock I tend to unwind and to relax. I know to enjoy myself a lot. I have multiple interests and hobbies that I usually involve in. um, I think saying no is important for doctors. Unfortunately, a lot of patients also expect too much out of us. They tend to send us
true,
reports in the night. They ask us to. They expect us to respond. If we don't respond, they think we are bad doctors. We don't
yes,
care about this thing. In fact, somebody on my social media, I posted some vacation pictures recently, uh, just because I wanted people to see happy things, a nice scenery. Some of my friends said that, I'm so happy to see your pictures. I feel so pleasant, right? But somebody messaged me saying that you're not answering to me, you're not replying to me, but you have all the time in the world to go to vacation. you know Guilt tripping doctors also need to be stopped. We're also human beings. We
right,
can't work like
yeah,
our
true,
body and brain is works exactly like your body and brain. It's not master.
true, true.
We are not master or something. So how do we
Right,
manage? I think we have to try to balance work and life. It's difficult, but I think we should do. I think COVID gave us, some of us at least, some relief in terms of um, we are able to say no, at least by saying COVID. we're able to say no. I know it's COVID, so so
Okay.
in those little ways.
Right.
Yeah, so yeah. I think hobbies is a great way. Having a hobby for me, travel and painting is one of my many hobbies. I regularly cater to it. So I think something like if you have a hobby, I think you're able to balance it very creatively and well. Yeah,
True. As you said, 4 to 5 is your rest, recreational time, and you gave that time to us. Thank you so much for that.
no problem, no problem. That's the only time I actually can do lives also, because by 8 o'clock I'll be
Okay,
very tired. I won't be able to speak.
right.
Yeah,
True, true. Okay, sir. Oh, thank you so much for coming live with us and giving your precious time to us. And thank you for actually working so hard for your patients and for us and during COVID too. And I really look forward to have more lives with you.
thank you so much. Thank you for having me, and you are doing a good job. Continue that, and I
Thank you
see
so
that your
much.
page is dedicated to mental health, especially. That's wonderful. I like that you are even talking about very people talk very privately some issues. I'm glad they're talking about sexuality, sexual health, mental health, etc. Because somebody needs to speak up. So I'm glad you're doing. More power to you.
Thank you so much, sir.
Thank you.
Thank you so much.
Have a good day. Bye.
Take care, sir. Good day. Bye.